Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. I'm here with Dr. Greg. Dr. Greg, how you doing today?
I'm doing good. How are you?
I am doing good. You know, I think it's kind of funny how I've been recently thinking that I have like a sense to predict the weather.
Oh, sixth sense, huh?
Yeah, it's crazy. I feel like anytime that the weather is shifting, gonna be wet, cold, rainy, whatever, it's like my body tells me it like specifically my hips and my knees.
I say all the time that my patients with arthritis are more accurate than your local meteorologist for sure.
Yeah. No, so, today I think we're going to talk a little bit about like if you're listening and your knees or your joints aches when it rains, like you're not imagining it. It's not what you think either. And Dr. Greg's going to dive into that a little bit more. And so, yeah, I have had to say, be honest and say that like when my knees have started to bother me, I'm like, something's going on with the weather. Like It's going to rain, it's going to be cold. There's some kind of shift that's coming in. So when it comes to weather and pain, is there actually a connection?
Yeah. And I mean, I would say the research is kind of not full-fledged saying there's a definitive way for people to predict based off of how they feel. But from my experience of doing this for 11 years, like patients will come and be like, it's going to rain today. I'm like, it is? The weather didn't say it's going to rain today. And I'm like, okay. And then by the time they're walking out, it's like pouring rain. I'm like, you hit it on the head. And they're like, I felt it. And so like the reason is, or at least the theorized reason is like when the barometric pressure changes, when it gets lower, we get more. This kind of affects the pressure within our joints. And so if you already have some osteoarthritis, you have some tissue damage, you have a little bit of fluid, this pressure then basically increases your ability to perceive pain because your threshold's dropping a little bit and the nerve endings are a little more sensitive. There's some things that say like you can actually alter like the fluid within your joints, so you get more joint stiffness and swelling when it's lower barometric pressure. So yeah, I mean there's definitely a connection for sure. So yeah, I mean I don't want to say that it's definitive like I said, but I think it is. I definitely think there's a connection.
Yeah, absolutely. So it's just crazy. I mean, that would make sense that if there's pressure changing, like we live in gravity and, gravity is kind of what holds us to the ground. And there's all these different, factors into that. I am by no means a scientist, but, I know that 2 + 2 = 4. So, it just kind of seems interesting when it comes
to like you said, like your knee, you feel it. So,
yeah.
I mean, that's not in your head. That's that you're feeling something change.
Yeah. Well, and more specifically on the opposite side of like when it's going to rain or the weather's going to be bad, especially like when it has been that way. And then there's a couple of days or we finally get into the days of sunshine. I was just telling you about how, a few weeks ago, I came back from a trip and I was a little under the weather and just really not feeling like I was getting better. And then all of a sudden, the sun came out and I spent as much time outside as I could. And I legitimately, like probably 85% felt better than I had the day before. And
right. And so I'm sure there's a mental and emotional aspect
absolutely
to all of this, but you were physically feeling better, which kind of launched that too.
Yeah, absolutely. So, what about younger or active people, people that don't have injuries or that they, they don't have this sixth sense when it comes to their joint pains. So what would be, why are they different from those who can kind of feel this pain, so to speak?
Yeah, I think it kind of relates to like how much actual tissue damage is going on from the joint and then the kind of your baseline fluid retention there. I think the fluid has a lot to do with the barometric pressure changes from what I can sense and learn from my patients. But I guess this is a good way to kind of just segue over and just talk about like knee pain for a second. I think knee pain, especially like the knee pain you feel like in the front of the knee, around the kneecap, it's kind of hard to pinpoint. Sometimes it's on the inside, sometimes on the outside. That's probably one of the most common things I see, especially in like the teenage through 20s and even 30-year-olds. And so I wanted to take this opportunity on this episode and kind of break that down a little bit. So usually what we're talking about in terms of like, I kind of classify them all as anterior knee pain because we treat them very much similarly, but you can have like a patellofemoral tendonitis or quad tendonitis, but this concept or this diagnosis of patellofemoral pain syndrome and what that actually is, because I think for the people listening, there can be some really easy, relatively easy things that you can add into your programming that can make a huge difference on that pain. And so the people with younger pain, typically your knee pain is that. It's not like your meniscus is breaking down unless you have, some traumatic type of injury. The meniscus is usually more of a degenerative change for our middle age and older individuals. Um, but for the younger people, it's usually like a patellofemoral syndrome, which is essentially like the cartilage between your kneecap and your femur starts to get irritated. And a lot of that can be explained like three simple things that I kind of broke it down to: hip mobility, hip strength, and quad flexibility itself. I would say the fourth one could be your ankle mobility, but we'll save that for another day. But what we see a lot of time is if your hip is immobile, meaning you can't rotate it well, then it's going to limit how much you can squat. We're going to put more pressure there. If your hip is weak, you're going to tend to put more pressure through that patellofemoral area, because when the hip is weak, the femur moves to the right or the left in that plane during a squat or lunge movement, and then the foot's still planted, so you're going to get a torsion through the joint, and that's going to basically mess up the alignment of how that patella is aligning with your femur there. And then the third is like quad flexibility and tightness itself. One of your quads, your rectus femoris, literally goes over your kneecap, encapsulates it, turns into your patellar tendon, which connects it to your shin bone. And when that's tight, it's literally just putting pressure of the kneecap right into the femur. And so I find this to be a super common thing that I treat in terms of knee pain. And probably, I hate to group it like this or generalize it like this, but it's probably one of the easiest things I can treat, especially if we catch it early. We catch it late, it gets a lot tougher. But for those of you younger with knee pain, just doing like some simple formaling of the quad, stretching the quad, and doing the right hip activation or mobility drills, and you could get rid of that knee pain in just a couple of weeks.
Yeah. Yeah. No, that sounds great. I should probably do those because I feel like I have knee pain a lot
Well,
of
you
times.
did have actual injury in the past, so
Yes.
it's a little more complex. But
Yes.
but to that point, I had a patient this morning who had had some of the same stuff we're talking about, and she's talking about, sometimes I feel in the hip, and okay, red flag, or at least that's a warning for me. And when somebody comes in with knee pain, especially patellofemoral pain or anterior knee pain, 90% of the time I'm not doing anything involving the knee for several visits. It is all hip. Sometimes it's a little foot and ankle stability. At the most, we're doing the quad tension relief through like foam rolling and dry needling and the right amount of stretching. And so just know that if your knee is breaking down, it's probably something going above or below it. 90% of the time, it's something involved in the hip. And so the right hip exercises can go a long way at changing the load that you're putting through that knee and limiting injury for a long time.
Yeah, absolutely. No, and I will say, not to just be biased or anything, but when I am doing those exercises and doing my homework outside of our visits, I do notice specifically less knee pain, less hip pain, and
Isn't that crazy, Dara?
oh my god. But my problem that I've had recently is just like ever since the wedding, it's just been like just hard to like re-stimulate things.
Of
So
course,
I
yeah.
haven't been in the gym as much, so I'm not doing my exercises as much because I don't think about doing them while I'm watching TV or
Right.
whatever. And I'll notice when I go through those phases, that mode, that's when my hip and knee pain starts to come up a little bit. So it is motivation
For
to be
sure.
like, hey, if I want to feel better, I need to do these exercises and move.
Yeah, and I don't want to dismiss that it's not hard to do. You're already doing. We're all busy. We're all doing stuff. But if you have certain things in life that you want to do from a movement perspective, sometimes the answer is as easy as coming to see an expert, knowing what you need to do for your specific ailment and what your individual assessment looks like, and then just putting a little bit of time, 30 minutes every other day into that. I think we all know we can spare that if we really want to, but I'm not here to. I have the same motivation problems that the things that I preach to my patients, I have to listen to myself. And it is definitely easier said than done. And if I don't do it before the kids get up, it doesn't get done. That kind of stuff. I totally get it. But to what you kind of said, if it can be something as simple as foam rolling while we're watching TV for 10 minutes, if that makes a 40% change over the next 2 weeks, well, come on, everybody can do that kind of thing.
Yeah, absolutely. So we talked about some different things as far as like the exercises that you would do with patients if they're coming in for knee pain with their hips and things like that. So but let's talk maybe about like not fixing the problem per se, but like what are some more specific things that will help actually fix it as opposed to just,
Oh,
whatever they're doing on their day-to-day basis.
yeah. So I think, like I said before, if we simplify into knee pain into the like most people need to do some type of quad relaxation or stretching, and most people need to do some type of glute activation. When I say glute activation, I mean both glute max and glute medius, which is the muscle on the side of the glute, or the side glute muscle. Um, those are my go-tos. Like, I have certain exercises that I always like to start people off with. You call them cookie cutter if they want, but they work for everybody. So there's a few things that if I know you have glute med weakness, we're going to start with these to get it going quicker and more efficiently. But I think the one thing that I like to do too is we have to go over your mechanics. So often, because we treat mostly active population, meaning everybody that comes to see us, or at least most people, are working out pretty avidly. A lot of CrossFitters, a lot of runners, a lot of people who just like to work out at F45 or what have you. And so they're doing the right things theoretically. They're working out, they're gaining strength, they're trying to stay in shape, they're eating well. But if you're every time you go into a squat or a lunge or some type of similar movement to that, if you're moving in a poor fashion and putting more stress on the knee, and the glutes and the hip muscles aren't taking their percentage of that ratio, then you're simply just overloading one joint and underloading another. And so it's like we've said with recently when we talked about baseball, the elbow's going to take it if something else doesn't do it, right? So in the knee joint, if the hip's not doing its job, the knee's going to take the force. So when we talk about movement mechanics or form, what I often am telling a lot of my clients is they tend to be ones who in their squat and their lunge, they keep their chest up, they let the knee drive forward, and they're putting way more shear force through that patellofemoral joint. And so I often say it's as simple as changing more of those movements to be more hinge heavy, so you recruit more glute and upper hamstring, and then not have to utilize the knee and still get the depth we want. So for instance, if you're doing a backwards lunge or a Bulgarian squat, so many people want to have their knee and their foot and their opposite back foot or foot on the bench so far apart, and then their knees way forward, their chest is upright, and they're doing up and down, and that's fine. But you are predominantly working the quad in that position, and so what I like to do during this rehab process is we have to expose them to new movement patterns. So I want that front foot to come way closer to that back foot or to the bench if you're doing a Bulgarian squat. Really focus on less knee bending, hips going back, chest coming forward, back staying straight so we're hinging at the hip, and recruit way more glute. Still get good quad recruitment and exercise and hypertrophy, but enhance how much the glute is doing relative to the quad, which also means you're going to put more stress in the hip joint and the low back joints in a proper way if you're doing good form versus all in the knee joint. Because some of these people are putting 80% in the knee joint, and the low back and the hip aren't taking any of it. So we need ideally the muscles to take most of it, but other joints to take some of it too. So changing your form is huge. And it's something that just most of my patients, even though they're super active and they have pretty good coaches, they've never been brought aside one-on-one and be like, this is how you have to do it. This is how you have to practice it. This is when and what time and how you should dose those practices. And then before you know it, you have new avenues to move within. So we're not putting stress on the same parts of the same joints in the same direction over and over and over again, which is the repetitive stress injury that 99% of people have when they need our help. So I guess to answer your question simply, it's you need to improve your mechanical movement patterns and your form in some of these exercises. And that's something that I genuinely love doing and have a passion for. So if you feel like your squat form is not where it needs to be, or from listening to this, you're kind of more confused than ever, and you need some one-on-one demonstration and have another set of eyes on you, then we're the place for you to go for sure.
Yeah, absolutely. So something to keep in mind is like your knee isn't protecting the weather and it's exposing a problem.
That's a good way to put it. Yeah, especially for the arthritic crowd that's listening. But for the younger people, yeah, to that point, your knee is the culprit of the hip and or like foot and ankle problem, because it's this hinge joint stuck in the middle of two very mobile joints. So if your knee is the pain, it's probably something going on higher or lower in the chain. And we have to address that. And even if you use the dry needling or the laser or the shockwave to take away your knee pain, if you don't change the way in which you're moving, I promise you the knee pain will come back. And like I've said before, we are not trying to put band-aids on boo-boos here at Movement Driven. We are trying to fix the thing that caused the boo-boo and make sure the boo-boo never comes back.
Yeah, absolutely. Well, I think this was a fantastic episode, very informative, something that is definitely motivating me to get back to doing my exercises and making sure that I'm doing them more consistently. But before we close out, is there anything that you want to add?
Yeah, I'll just say if your knee hurts when you do squats and lunges and you're going downstairs and you think that's normal, you're wrong. Come see us and we'll do an eval and we'll do a movement assessment. We'll give you a very specific exercise regimen that you need, and I promise you it's different than what you've experienced with physical therapy in the past.
Yeah, absolutely. Well, thanks so much, y'all. If you've got any questions, you can visit us online at movementdriven.com. You can book a discovery call and specifically talk with Dr. Greg about what's going on. Or you can just schedule an eval and get in here, ask some questions, get some movement, and then get some direction for moving forward. But thanks so much, Dr. Greg, and we'll catch you on the next one.
See you guys.
Thanks for tuning in to the Movement Driven podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.